Thank you, Madam Chair, and thank you for having this hearing. This is extremely important. Thank each and every one of you for being here. Dr. Feldman, earlier you had a conversation about list price, and my colleague before me just mentioned about list price, and we were talking about it. Ms. Bass, you mentioned that your concern was net price. Let me ask you, a copayment to a patient, is it based on list price or net price?
Copayments are a set price.
Copayments are a set price. They could be a percentage. Is that percentage based on the list? Is that percentage based on the list price or the net price?
Coinsurance is typically based, it depends on the plan, but in Medicare, say, coinsurance is based on the list price.
On the list price. So if the list price is higher, then the copay to the patient could be higher. Yes.
That math works.
That math works. Good. That's new math, but it still works. Great. Let me ask you, in Medicare Part D, also, patients go from deductible to the donut hole and then into the catastrophic. Is that based on list price or is that based on net price? It's based on list price. So the higher the list price, the quicker they get into the donut hole, the quicker they get into catastrophic. They get into catastrophic, then the taxpayer is the one who's on the hook because they're paying the majority of it, not the plan sponsor, not the insurance company, correct? That's correct. Let me ask you, Dr. Feldman, you mentioned correctly that when Ms. Bass was asked about how many members or how many PBMs there were in the nation, there were 66, I believe you said. However, you mentioned that there were 3 PBMs that control 80% of the market, and that is correct. Not only that, but also those PBMs are also those 3 PBMs that control 80% of the market also have an insurance company that they own and also have pharmacies they own. In fact, that vertical integration carries over into that. You mentioned that you had some patients who came in and had a letter that said that they had to change a particular drug to something else that was on the formulary. Just out of curiosity, any of those, the insurance or the pharmacy is owned by that PBM, or would you know that?
This was a particular PBM that is now owned by an insurance company.
Exactly. So in other words, the PBM is directing that patient to use a drug on the formulary through their mail order pharmacy or through their pharmacy. It may not be a mail order because we know that Aetna owns CareMart, owns CVS. We know that Express Scripts owns Cigna, owns Express Scripts mail order. We know that Optum is owned by United and has their own mail order as well. So what we're essentially talking about here is taking money out of one pocket and putting it in the other pocket. Because if you ask the PBMs, where are these discounts, as the chair lady likes to say, or rebates going, they say, well, they're going to the plan sponsor to decrease the premium. Well, who's setting that premium? The insurance company that they own in many cases. So that vertical integration is something that's very concerning. Let me change gears here for just a second and ask Dr. Miller and Dr. Holtz-Eakin. Earlier, Ms. Jolderson was asked about one of the parts of this bill that says that drug companies would have to give notification before they went up on a price, and there was concern about stockpiling. Are you familiar with spread pricing and how that works, either one of you?
Yes.
Okay, and do you agree in her assessment that, you know, if we know that if a pharmacy or a wholesaler knows that a price is going to be going up, that there's a possibility that they would stockpile those drugs in order to buy them at a lower cost and then also to be able to keep them so that they can sell them at the higher price?
My own comments are that, and I just want to preface by saying I still don't think that the transparency has a huge effect. But
did I ask you that? What I asked you about was the spread pricing.
To the question that you're asking.
Thank you very much.
I think I would say that I would not do a prior notice.
You would not do a prior notice?
The reasons that you're raising.
Thank you.
I'd be concerned about that as well.
Absolutely. And I can tell you from firsthand experience and from having been in business and owning a pharmacy for 30 years before I became a member of Congress, that was something we did all the time. If we knew the price was going up, of course we're going to buy it at a lower price and stockpile it. So there is a danger there. And I would warn you very carefully in this legislation to be careful of that. That is something that could happen. Madam Chair, I want to thank you again for holding this hearing, and also the Prescription Pricing for the People Act that has the FTC that an investigation into potential anti-competitive business practices in the PBM pharmacy relationship. That is an issue that our committee has asked the FTC to investigate, and I hope that, Madam Chair, that will come to us and that we'll have access to that report so that this committee can look at it. Thank you, Madam Chair, and I yield back.
Gentleman yields back.